Could you imagine being a child born with a visible split in your lip or palate? How about having a skull that is not growing or having an abnormal shape? What about having your jaw that sits too far forward or too far back, making it very difficult to eat, speak, or even sometimes breathe? All of these things can look and sound very unsettling, but for many children, craniofacial surgery offers not just a physical correction, but a chance for a brighter and more confident future. Craniofacial surgery plays a major and crucial role in pediatric care. With surgical procedures such as a cleft lip or cleft palate repair, craniostenosis surgery, and orgnathic surgery, they don't just address the critical physical abnormalities. These procedures also enhance a child's quality of life by improving their ability to eat, speak, and interact, socially helping with both their physical and emotional well-being. Today we will discuss the 3 most common craniofacial surgeries performed in pediatric care. We're going to discuss cleft lip and cleft palate repair. Then we're going to discuss craniostenosis surgeries, vaults versus springs. Then orgnathic surgery, also known as jaw surgery. I have the privilege of doing these cases that are amazing, life-altering, and at work every week. This gives me first-hand experiences and knowledge of the profound impact on children's lives. A cleft lip and palate are congenital conditions that occur when baby's lips and mouth do not close properly during pregnancy, leaving a visible gap. According to the American Cleft Palate Craniofacial Association, roughly 1 in 700 babies are born with a cleft lip. The first surgery is normally done between 3 to 6 months of age to close the cleft and restore normal appearance and function. This procedure alone improves the child's speech, facial symmetry, and child's ability to eat, drink, and breathe. Depending on severity of the cleft, the child could go under a total of 3 different stages. Now that we have talked about a cleft lip and palate repair, let's move on to craniostenosis. Craniostenosis is a condition where the sutures in a baby's skull closes too early, causing abnormal shapes and pressure on the brain. 2 main types of surgery that can be performed is a vault remodeling and cranial springs. A vault remodeling removes part of the skull and reshapes it, allowing for proper brain growth, as well as cranial spring placement. These springs that gently separate the sutures over time, separates the suture over time, correcting the shape of the skull without having to do a cranial vault, the child needing a more invasive procedure. According to Gillette Children's, craniostenosis affects 1 in 2,000 infants who require remodeling. Usually, only 1 surgery is required at the ages of 4 to 6 months. But about 10% need a second procedure to correct still deformities. These procedures can prevent developmental delays, cognitive impairments, and cosmetic deformities. After exploring craniostenosis surgery, let's now turn our attention to procedures that are used to correct jaw alignments, orgnathic surgery. Orgnathic surgery, better known as jaw surgery, is performed to correct moderate to severe jaw deformities and misalignments that are unable to be fixed with braces. According to the Children's Hospital of the King Daughters, the proper alignment of the jaw can improve a child's ability to breathe, chew, and speak. If the jaw misalignment is left untreated for too long, it can cause premature tooth wear, pain, temporomandibular joint pain and problems, and other complications. Different types of jaw deformities that are corrected include overbites, underbites, misaligned jaws. They can be corrected by Lefort osteotomies, which is 3 stages, biomaxillary surgery, and maxillary and mandibular osteotomies, to name a few. When they do these types of procedures, they're very invasive and painful. They have to cut different splits into the jaw and break the jaw and manipulate it and then wire them shut. To conclude, let's quickly review the major craniofacial procedures we've discussed today and their impact on children. Craniofacial surgery is crucial in pediatric care. First, we explored cleft lip palates and lip repairs that help children eat, speak, and breathe. Next, we discussed cranial stenosis surgery, including cranial vault remodeling and spring applications, which correct skull deformities and prevent brain damage. Finally, we examined orthodontic surgery, also jaw surgery, which realigns the jaw to improve facial appearances and functions. Through these life-changing procedures, children are given the opportunity to thrive and grow, as well are able to face the world we face every day. They have greater confidence and a healthier outcome. Sometimes the greatest transformations begin with just an incision.